Welcome to this explainer. We're diving right into a pretty profound reality today. How the exact place you're born fundamentally dictates what you might die from. When you really get down to it, global health is a story of global inequality. So we're going to break down the data and explore the vastly different patterns of health, disease, and mortality that play out across our planet.
Let's kick things off with a staggering number: 17 years. That is the gap in life expectancy between someone living in a high-income country versus a low-income country. Just think about that for a second. That's 17 years of stolen time, based purely on geography and the underlying economic realities of where you happen to be born.
To understand how we get there, here's our roadmap for today. We'll cover a story of global inequality, the Big Three and NTDs, protecting mothers and children, changing patterns of disease, and finally, the Sustainable Development Goals. Let's jump right into Section 1, a story of global inequality and how income shapes our lifespan. The World Bank breaks countries down by gross national income per head, and the correlation with survival is undeniable. Life expectancy drops steadily, going from 81 years in high-income nations down to just 64 years in low-income nations. It is a perfect, though tragic, illustration of how macroeconomic underlying causes completely dictate individual health outcomes.
It creates a bizarre contrast. In high-income regions, people are casually hopping online, plugging their age into life expectancy calculators just to see if they'll hit 100. It's the luxury of longevity. Meanwhile, underlying factors like poor sanitation, overcrowded housing, and undernutrition are drastically altering the math for the world's poorest.
Moving to Section 2, the Big Three and NTDs, looking at the immediate infectious threats.
Take HIV, for instance, which is massively concentrated in sub-Saharan Africa. HIV is the first of what global health experts call the infectious Big Three. Without effective treatment, it destroys the immune system, making it a leading immediate cause of mortality in low-income areas.
Then there's tuberculosis, another of the Big Three, and it follows a really similar geographic pattern. TB heavily burdens the exact same lower-income regions, spreading rapidly in areas where underlying factors, like poor living conditions, are widespread.
Rounding out this trio is malaria. What's so frustrating here is that malaria is a highly preventable, mosquito-borne disease, yet it still heavily burdens the African continent with devastating immediate mortality, especially among young kids. So HIV, TB, and malaria. These three communicable diseases are massive drivers of that 17-year life expectancy gap we talked about.
But we can't just talk about the Big Three. We absolutely have to understand neglected tropical diseases, or NTDs. This is a fascinating and heartbreaking category, including things like dengue fever, rabies, and leprosy. They're considered neglected because they receive just a fraction of the research and investment that the Big Three get, yet they create an insidious underlying trap of illness and poverty for millions of the world's poorest people.
A perfect example of this is dengue fever. Because of underlying environmental shifts, specifically the climate crisis causing warmer temperatures and flooding, the mosquito vectors that carry dengue are expanding their reach into places like the Caribbean and the Americas. Deaths from dengue surged more than 200% in these regions recently, which perfectly shows how a changing environment directly amplifies immediate health threats.
Let's move to Section 3, protecting mothers and children, focusing on our most vulnerable populations.
Before we dig into the data, it really helps to know exactly what timelines we're measuring. Neonatal mortality refers strictly to the very first month of life. Infant mortality covers the first year, and under 5 mortality looks at the entire early childhood window. Distinguishing these is absolutely crucial because it helps global health workers target specific immediate causes of death that strike at different developmental stages. When we look at maternal mortality, which tracks deaths from pregnancy or childbirth complications, the disparity is jarring. A woman in a low-income country faces a staggering 1 in 45 lifetime risk of dying from maternal causes. Compare that to 1 in 5,500 in a high-income nation. That is a massive divide, and it's driven largely by a lack of basic interventions like antenatal care and skilled birth attendants. Now, it's not all bleak. Over the last 30 years, we've actually seen a significant, hopeful decline globally in both under 5 and neonatal mortality rates. This drop is largely driven by scaling up low-cost, highly effective interventions. We're talking about simple but powerful tools like vaccines, insecticide-treated bed nets, and oral rehydration therapy. Even so, we obviously still have work to do.
The child and neonatal deaths that remain are heavily driven by preventable immediate causes, like lower respiratory infections, preterm birth complications, and diarrhea. And it's so important to remember that an underlying cause, undernutrition, is directly linked to nearly half of all these global deaths for children under 5.
Section 4. Changing patterns of disease and what we call the double burden.
The double burden of disease is a crucial concept to wrap your head around. Historically, developing nations primarily fought communicable, infectious diseases. But today, as populations age, cities grow, and risk factors like poor diet and smoking rise, low- and middle-income countries are simultaneously facing a massive surge in non-communicable, chronic diseases. It is a true double burden that stretches their healthcare systems to the absolute breaking point. Looking at the numbers for low-income countries in 2019, communicable, immediate causes still completely dominate the top 10 list. Neonatal conditions, lower respiratory infections, diarrheal diseases, and malaria remain the primary killers.
But watch what happens when a country moves into the lower middle income bracket. We start seeing underlying factors like aging and changing nutrition push non-communicable diseases, specifically ischemic heart disease and stroke, to the very top of the list, sitting right alongside things like neonatal conditions. This perfectly illustrates that complex double burden of disease we were just talking about.
Finally, Section 5, Sustainable Development Goals, our roadmap for global health equity.
The United Nations established 17 Sustainable Development Goals, or SDGs, to build a better future. Out of all of these, goal number 3 is specifically targeted at ensuring healthy lives and promoting well-being for all, at all ages.
The key takeaways for SDG 3 are the actionable targets set for the year 2030. They are wildly ambitious. We're talking about drastically reducing maternal mortality, ending preventable deaths of newborns and children under 5, halting the epidemics of the big 3 and NTDs, and achieving universal health coverage. It's a full-on attack against both the immediate and underlying causes of global health inequality. As we wrap up this explainer, I want to leave you with a question to chew on. We've seen how income, infrastructure, and geography shape human survival. The data doesn't lie. So if global health is fundamentally a story of inequality, how can we, as a global community, ensure that geography no longer dictates destiny? What kind of unprecedented cooperation is it going to take to finally close this devastating divide? Thanks for joining me today. Keep asking questions and keep seeking to understand the data that shapes our world.